All right, welcome to The Explainer. Today we're going to dive into the story of our stomachs. It's a story all about powerful acid, delicate defenses, and what happens when that balance gets thrown off, leading to everything from a little heartburn to some pretty serious ulcers.
We've all been there. That burning feeling in your chest, that discomfort you get after a big meal. We call it heartburn. But what's really going on in there? What's the actual story behind that feeling when things in our stomach start to go wrong?
Okay, to really get this, I want you to picture your stomach lining as a fortress. It's a fortress wall. And inside that fortress is this incredibly powerful acid that's designed to just dissolve anything we eat. So the whole job of that wall is to keep the acid contained, to make sure the stomach doesn't, digest itself. It's a really delicate and super important balance.
Now, when that balance gets disturbed, the very first sign of trouble is usually this, gastritis. And all that means is inflammation of the stomach lining. It's the first crack in our fortress wall. It's super common, and it's really the starting point for a lot of stomach problems.
So this whole delicate balance really just comes down to two forces battling it out. On one side, you've got your defense team, prostaglandins, building up this thick, slimy mucus layer. That's our fortress wall. And on the other side, you've got the attacking force, hydrochloric acid. It's essential for digestion, but it is so strong that it would totally destroy the stomach without that barrier.
So, our stomach's entire system, its whole health, hinges on keeping this delicate balance. But here's the thing, that fortress is under constant assault from the outside world. So what happens when common irritants start to wear down those defenses?
Well, the first sign that things are going wrong is gastritis. It's kind of like the body's warning light, that inflammation that pops up when the fortress wall has been breached by irritants, leaving it exposed and vulnerable.
And what are these attackers? Well, a lot of the time, they're common things we invite in ourselves. Long-term use of NSAIDs like ibuprofen is a huge one because it directly messes with the chemicals that build our protective wall. And of course, things like excessive alcohol, caffeine, stress, and smoking, they're all well-known risk factors that can seriously weaken the fortress's defenses.
But, while all those things are definitely major players, the most common cause of long-term or chronic gastritis isn't actually something you drink or smoke. No, it's a tiny organism that has absolutely mastered the art of surviving in one of the most hostile environments you can imagine.
When that chronic inflammation from gastritis just goes on and on unchecked, the damage gets way deeper. A small crack in that fortress wall can become a full-blown breach. And this is when the problem gets a lot more serious. This is when we start talking about ulcers.
The official name for this condition is peptic ulcer disease, or PUD for short. And it's what happens when the stomach's defenses are so worn down that the acid actually starts eating away at the lining itself, creating a painful open sore. That's an ulcer.
And the number one cause of peptic ulcer disease is that microscopic infiltrator we just hinted at. It's a remarkably clever little bacterium called Helicobacter pylori, or H. pylori for short, and it is responsible for the vast majority of ulcers all around the world.
So how is this tiny bacterium so good at surviving in such a hostile place? Well, its attack plan is kind of brilliant. First, it has this corkscrew shape that lets it literally drill into the mucus layer to hide from the acid. Then, it produces this special enzyme that creates a little bubble of neutralized acid around it, like a personal force field. And finally, its very presence kicks off this huge inflammatory response from your body that directly damages the fortress walls, paving the perfect path for an ulcer to form.
And not all ulcers feel the same. A really big clue is when the pain shows up. With a stomach ulcer, the pain often hits pretty soon after you eat because the food is irritating that sore. But with a duodenal ulcer, which is right past the stomach, the pain usually starts a few hours later when your stomach is empty. And in that case, eating can actually make it feel better for a little while by soaking up some of that acid.
And we absolutely have to take ulcers seriously because the complications can be severe. Hemorrhage, which is just bleeding, is the most common and the most dangerous one. An ulcer can also perforate, which means it eats a hole all the way through the stomach wall. That's a surgical emergency. Or it can cause so much scarring that it creates an obstruction, blocking food from getting through. So after hearing all of that, you're probably wondering, okay, how do we fight back? How do we actually repair that breach in the fortress and get things back in balance? Well, fortunately, the treatment is just as clever as the bacterium's attack. And here's the best part. Because we know the primary enemy is H. pylori, we have a really effective battle plan.
Discovering that a bacterium was the main cause of ulcers was a total game changer in medicine, and it means we can go after it directly.
The standard treatment is usually a three-pronged attack called triple therapy. First, you've got a proton pump inhibitor, a PPI, which basically tells the stomach to chill out and make way less acid. This gives the ulcer a chance to heal. Then, at the same time, you get 2 different antibiotics to make sure those H. pylori bacteria are completely wiped out.
But, treating the problem you have right now is really only half the battle. Why is it so absolutely critical to manage this stuff, and what are the long-term stakes for our stomach's health?
And this right here is why long-term health is so critical. An untreated chronic infection with H. pylori is more than just a risk for ulcers. It is the single largest risk factor for developing stomach cancer. All those years of nonstop inflammation can eventually cause some really dangerous changes in the cells.
Now, when stomach cancer is caught in its early stages, the 5-year survival rate is actually pretty good, around 70%. With early detection, it is a very treatable disease.
But if it's not caught until the disease is already advanced, that number plummets, down to just 30%. This huge difference is why managing your stomach health and treating an H. pylori infection isn't just about comfort, it is absolutely about prevention.
So, what can you do? The steps to protect your fortress are actually pretty straightforward. It's all about minimizing those irritants we talked about earlier, eating a balanced diet, avoiding too much alcohol, being careful with long-term NSAID use, managing your stress, and stopping smoking. And hey, if you have chronic symptoms, go get treatment.
So, that leaves us with one final thought. Your stomach is this amazing, resilient fortress, but it completely relies on that delicate balance to defend you. Knowing the risks is the first step. The next is to just ask yourself, are you protecting your fortress?